blood labs, interviews for rats. Today we're going to talk about chapter 11 from the step-by-step book, and that chapter covers evaluation management. So, evaluation management section is 52 books, reports to the subsections are by type of service, and type of service could be office, hospital, or three factors of evaluation and management code that place of service we need to take into consideration. Where was the patient seen? Hospital, office, home, observation, emergency department. The type of service also is what we need to take into consideration. And the so place of service, as I said, can be office, emergency room, home. The type of service could be an office visit, an admission, consultation, or so patient status, there's four types: new patient, established patient, outpatient. And new patient is a patient who's not received any professional service in the last 3 years from the same physician or another physician in the exact same specialty and subspecialty, and who is in the same group. A new patient takes more time to get evaluated. An established patient has received professional services in the last 3 years from the same physician or another physician of the exact same specialty and subspecialty in the same group. Medical record is available with current, relevant information, so it makes it quicker for the physician seeing an established patient. Outpatient is one who has not been formally admitted to a healthcare facility, like a patient receives service at a clinic or a same-day surgery center, like, for example, going in for a mammogram in outpatient, or going into outpatient for a biopsy. Those people have not stayed in the hospital, have not been admitted. Patient can be admitted for status as well. Inpatient is one who has been formally admitted to a healthcare facility like a hospital or nursing facility. An attending physician is going to dictate the admission orders and the history and physical and request consultations necessary. The key components to evaluation and management are the history, the patient's history, the examination, and the decision making. There's some contributory factors which are counseling. For example, if I have a concern about my mother's health and I want to speak with her doctor, uh, I am not the patient, I'm the family member. My mother's the patient. Well, I can get an appointment with the doctor and go and talk to him about my mother's care, with my mother's consent, of course. Another contributory factor is coordination of care. Like, for example, if a patient is discharged from the hospital to a nursing home, doctor has to write the orders and coordinate the care for that particular patient. The nature of the presenting problem is also something to take into consideration. So when we think about the history of the present illness, the chief complaint is when the patient comes in and says, the doctor say, why are you here? The patient say, well, I have lower back pain, for example. That's the chief complaint. And then the history of the present illness, the doctor's going to take notes about that particular lower back pain, and he's going to do a review of systems, and he's going to also do a past family and social history, but this is mainly for new patients. New patients. So the history of the present illness is subjective. It's a description of the development of the current illness with the date of onset. Like, for example, the patient is going to describe when the back pain started, the date. If the patient cannot answer for themselves, a parent, a guardian, or someone else may provide information. And there are 8 elements in the history of the present illness. And the doctor is going to document what the patient is talking about, what the patient is saying regarding the history of the present. The dialogue could be like abdominal pain. Chief complaint is abdominal pain. It started Thursday night, was mild, and during the night it got worse. Friday morning I went to work but had to leave because the pain got so bad. Um, Another would be location. He's saying, okay, the pain was in the lower left hand side, a little bit back. The quality, the pain is sharp, dull, pressure burning, the sensation. The patient in this case said the pain is really sharp, constant. So the severity of the pain on a scale of 1 to 10, what is it? The patient said, pain is terrible, the worst pain I have ever had. So duration, the patient has been going on now says the pain was going on for 3 days now. Timing, when does it, if the pain is present all the time or does not come or comes and goes. And the patient actually said in this case, the pain just continues to go away. So just a couple of sentences that the patient spoke with the doctor, there was a lot of information there. Context, when does it hurt the most? Is there a correlation to a specific activity like climbing the stairs? And the patient said the pain is just there, it doesn't matter what I'm doing. Modifying factors, anything that makes it better or worse. And the patient actually said nothing I do makes it any better or worse. Aspirin was taken, but there was no. So associated signs and symptoms related to that particular problem. Does anything else feel different when the pain is present? And the patient says, yes, I have nausea when pain. Next, let's talk about the review of systems. And organ systems are respiratory, um, cardiovascular. There's 14 elements in the review of systems. So we have a lot of body systems, like integumentary, musculoskeletal, neurological, etc. Constitutional, and this is usually done by the MA or the nurse. General appearance is taken into consideration. Does the patient have fever, weight loss, or gain? We call that constitutional. Like the MA or nurse will take our blood pressure and temperature, right? Eyes is an organ system. Ear, nose, and mouth are organ system, are organ systems. Respiratory, gastrointestinal, genitourinary, muscular, integumentary are all organ systems as well as neurological. Psychiatric and endocrine, hematologic, lymphatic, all of those are organ systems as well as allergic and immunologic. The past family and social history, we call this the PFISH. It's just relevant information about the past major illnesses or injuries, any operations, hospitalizations, allergies, immunizations, dietary status. And this PFISH is done usually only the first time that the patient comes in, or maybe once a year, not every visit for sure. The social history contains relevant information about sexual history, employment, past and present medications, social, tobacco use, family history, parents, siblings, children. Okay, so a problem-focused history is a brief history that focuses on the chief complaint. And there's no review of systems and no PFISH. The brief history includes one to three of the 8 elements in the history of illness. Expanded problem-focused history is a brief history focusing on the chief complaint with a brief history of the present illness. Less than 3 of the 8 elements in 1 to 2 chronic problems. The review of systems as it pertains to the presenting problem is documented, and there's PFISH. Then we have a detailed history, which is an extended history of present illness. That would be 4 or more of the 8 elements. And when we say elements, we mean the body systems that we talked about just now previously. The patient would have 3 or more chronic conditions, an extended review of systems, and a pertinent comprehensive history has an extended history of the present illness, a complete review of systems, and a fish. And here we go. This is a summary, and you have this little chart in your book, so you can see here. We're just talking about history here. You have the problem focused here, expanded problem focused, detailed, and comprehensive. And here you have your history of your present illness, and it tells you brief, 1 to 3, brief. You can see detailed and comprehensive have 4 or more. Then the review of systems. With the problem-focused history, there's no review of systems. And then the P-fish here. The elements required for each level of exam. This is the review of systems. A problem focus is going to be limited to the affected body area or organ system. Like, for example, if I go to the doctor saying that I have a sore throat. Well, the doctor is going to check my throat and probably my ears, and that's it. This is it, limited, affected only to the body area or organ system that I am complaining about. Then we have an expanded problem focus, limited to the affected body area, organ system, and other related organs, like maybe a sore throat and plus maybe listen to my chest. Then there's detailed, extended of affected body areas and other related organ systems. And documented would be 2 to 7 organ systems or body areas. With the expanded problem focus, it would be 2 to 7 as well. With comprehensive, it would be more than 8. So if it isn't documented, it did not happen, right? So if the doctor did not document something in that medical record, we cannot we cannot code for something that's not documented. And what they're saying with this is that with evaluation management, if the doctor only did 2 body areas, we cannot code for 4 body areas. So the 3 elements of medical decision making. So this is one of the 3 key components to evaluation management. The first we said was the history of the present illness. The next one was the exam or the review of systems. And now the third one is the medical decision making. It's like doctor is going to decide now what is going to be your treatment. So he has to take into consideration the number of diagnoses and management options, minimal, limited, moderate, or extensive. Also, the amount and or data to be reviewed. It could be minimal, it could be extensive. And third, the risk of complications or death if the problem goes untreated. Straightforward medical decision making, number of diagnoses or management options would be minimal. Amount and the data of complexity of data to be reviewed, risk is minimal. For moderate, the number of diagnoses or management options are multiple, and moderate complexity of data, and the risk of death is moderate. So data to be reviewed in any of these cases would be, what is the data? Well, laboratory, radiology, any test or procedure that the doctor is ordering, or results that documented in the medical record. That's all stuff that the doctor needs to take a look at and review. A review results should be documented in the medical record. Maybe the doctor writes hemoglobin is within normal limits. Trade negative. That means the doctor reviewed that information. Old medical records from other physicians may be reviewed as well. So the risk of morbidity or mortality, would be, for example, complications. There could be complications or even death with problem and or other diseases or factors that affect the risk could be diabetes, age, urgency relates to the risk, like myocardial infarction. There's an urgency there, right? Ruptured appendix, that as well. And we have 4 risk levels: minimal, low, high. Uh, uh, sorry, but the risk levels will be low would be several minimal levels, or one level that is more than minimal. Multiple would be like a wasp thing. With the minimal would be, the first one would be a wasp sting. Okay, so low would be more than the minimal level, which would be multiple wasp bites. And the third is moderate, 1 or more chronic illness, diabetes, 2 or more stable but chronic conditions. Like, for example, high blood pressure could be a chronic condition, as well as diabetes, controlled high blood pressure and diabetes. Moderate risk level is a undiagnosed condition with an unknown prognosis, like a breast lump, an acute illness, or pneumonia. And the risk levels for high would be 1 or more chronic illnesses with current severe exacerbation, malignant hypertension, and uncontrolled illness or injury that is life-threatening, such as myocardial and cardiac arrest. So, summary of the medical decision-making risk right over here. And you have this chart as well in your book. So, and this helps a whole lot because nobody remembers all of this stuff in this little chart right over here. So, the number of diagnoses, amount of complexity data, and the risks.